Why should medical marijuana be legalized for people who need it? The dangers and risks of marijuana use are well known by the scientific community. Medical marijuana is marijuana that is recommended by a doctor for the treatment of a medical condition. 29 out of the 50 states have legalized marijuana with a doctor's permission. If you live in a state where medical marijuana is legal and your doctor thinks it would help, you'll get a marijuana card. Having this card puts you on a list that allows you to buy marijuana from an authorized seller called a dispensary. Pain is the main reason why people ask for a prescription, possibly from headaches, a disease like cancer, or a long-term condition like glaucoma or nerve pain. Marijuana can sometimes help your natural chemicals that affect pain. There are many different pros and cons of using medical marijuana. The legalization process to legalize medical marijuana across the United States has been a long process. There are many different reasons why people are treated with medical marijuana, including diseases and pain relief. Medical marijuana is a very controversial topic, and there are a lot of different viewpoints on this drug. The first thing I would like to address in my speech is the controversy over medical marijuana, starting with the pros and cons over the drug. Physicians who are for medical marijuana say that there's a promising research that proves that marijuana could impact tens of thousands of children and adults, including treatments for cancer, epilepsy, and Alzheimer's. These studies have shown that in regards to pain alone, marijuana could greatly reduce the demand for narcotics and simultaneously decrease the number of accidental painkiller overdoses, which are the greatest cause of preventable deaths in the country. Physicians who are against medical marijuana state that there is really no such thing as medical marijuana. These physicians state that medical marijuana is downplayed by corporate interests wishing to get rich off legalization. According to these physicians, marijuana causes loss of production, addictive disease, deterioration in intellectual functions, motor vehicle accidents, and psychosis are all among the negative outcomes. Also, they have stated that for all the conditions which marijuana has perpetrated benefits, we already have existing medications. These medications are safer than medical marijuana. Also, there is a lack of consistent, repeatable scientific data available to prove marijuana's medical benefits. To many people, marijuana is very dangerous and an unnecessary drug. My second point of interest is the legalization of medical marijuana. In 1996, California was the first state in the United States to legalize medical cannabis, sparking a trend that spread across most of the United States. Since then, 28 more states and Washington, D.C. have legalized medical marijuana, which is more than half of the U.S. Medical marijuana must present a written to oral recommendation from their physician. There are set limits for possession and cultivation of marijuana by eligible patients and their caregivers. Although the states issue medical marijuana identification cards, registration is not mandatory for compliance. In 2012, Colorado became the first state to legalize recreational marijuana. The legalization of marijuana is a very long process, as almost half the United States still has not legalized any use of the drug. Lastly, I would like to talk about treating illness and disease with medical marijuana. Pain is the main reason people ask for the prescription for medical marijuana. Doctors may prescribe medical marijuana to treat muscle spasms caused by multiple sclerosis, nausea from cancer, chemotherapy, nerve pain, seizure disorders, and Crohn's disease. Medical marijuana can be used to treat these illnesses in many different ways. Marijuana may be smoked, vaporized, eaten, and taken as a liquid extract. Although there are many side effects to using medical marijuana, such as dizziness, drowsiness, and short-term memory loss. Using medical marijuana has many risks along with the side effects. It could cause cancer and it could cause addiction to the drug. Treatment for medical marijuana is mostly for the pain and should be prescribed by a doctor. Medical marijuana is an extremely controversial topic, and legalizing this drug is a very big risk. This drug has a lot of potential to be very helpful if used correctly. It could get into the wrong hands and be used by someone who does not need marijuana for any reason. I think that soon all the states will legalize medical marijuana for people in need of it.